I'm Sandy Herrington. I am a physician, radiation oncologist. I did my medical school at University of Kansas, go Jayhawks, and went to undergraduate in a Big Ten school, and also did some graduate work at University of Oklahoma. I've been a radiation oncologist since 1990, so a great deal of experience there. And it's been a very challenging profession, extremely rewarding, sometimes heartbreaking, but not something I would want to change as a decision for how to spend my professional career. My interest in cancer treatment in general probably dates back to when I was in elementary school. My father died from melanoma when he was 39 years old. Obviously, that made me acutely aware of the problem with cancer, including in young people. I had initially planned to be a biologist, but by a roundabout route actually went to medical school. And when I was looking at the different specialties, I was very interested in radiation oncology, not just because of the cancer care aspect, but also because it's very visually oriented. And the one-on-one time that we spend with people and the ability we have to help people in almost all circumstances made that very attractive as a career for me. We treat most types of cancers. I have not been involved with treating pediatric cancers since my Air Force days. Those are generally better addressed at specific children's hospitals, but all adult cancers, I do have particular interest in some of them, melanoma being one, breast cancer also, but we also treat very unusual cancers that you don't see every day. We will try to help anybody that comes to us for assistance. When somebody comes to us for an initial consultation, the first thing we do is we sit down with that individual. We talk to them about their disease process, the stage of the cancer, and we go through what are the general recommendations, the clinical practice guidelines for management of their particular cancer. Most cancers now involve multimodality treatment, a combination of radiation therapy, chemotherapy, surgery, sometimes all three. And so we talk about the need to coordinate. We also talk about the particular area that we would be treating and all of the potential side effects and also potential risks associated with that treatment. We want the people we work with to be very well informed about their disease and the expectations from the radiation therapy. Once we've completed the consultation, then we schedule what we call simulation. It's a session where we plan out the treatment. We will develop any particular position that we need the individual in for their treatment. We will get a special CAT scan of the treatment area and do any additional things that we have to do to ensure that we can have a meticulous day-to-day treatment setup for each individual. The treatment is always custom shaped, custom designed for each particular person, no matter what their situation is. Once we've done that simulation, then we have to do some behind-the-scenes treatment planning, which is technically very involved, and it can take some degree of time. It's very labor-intensive for both the physician and the other department staff that are involved in the planning process. When we're done with the planning, then we'll bring a person in for their initial treatment. At that time, we do a verification. It's, in a sense, like a pilot doing their checklist before they take the airplane off. We make sure in every aspect that the treatment is correct, and we continue to verify all the way through a treatment course that everything is being done correctly. Once we get started with treatment, it's a pretty streamlined process. Most people are in the department for about 30 minutes. only on the treatment table for about 10 minutes. The beam is only on for about a minute. You do have to have a sit down face-to-face with the nurse and the doctor at least once a week all the way through the treatment so that we can check and see how each person is doing with the treatment and do we need to make any adjustments in supportive care. It's important to recognize that for most of the treatment we do, it's called external beam radiation therapy. We use very strong X-rays, and so there is no radiation at all that is left in a person with this treatment. No one's radioactive when they walk out of the department or anything like that. So there's no concern about exposure to loved ones or anything along that line. And these are also things that we will educate people about before they start a course of radiation therapy. I think that anyone that comes to this department, to this facility, is going to be really impressed by the genuine caring of everybody in the department. Because we are part of this community, we care specifically about people in this community, but also the equipment that we have here is thoroughly up to date, high quality equipment, and people can be confident that the care they're going to receive is of the highest quality, both from the personal experience standpoint and also the technical aspect of the treatment. A really nice aspect of being treated here is this very personal nature of the care. Everyone knows each patient individually, and that is not always something that a person experiences in a large center when you're getting treatment along with dozens and dozens of other people. I see, and all of us see very frequently, discussions on TV by this or that celebrity about how we need to find a cure for cancer. The truth is, we cure cancer all the time. Also, importantly, the side effects have gotten less. For example, with our technology, we now have much better methods of seeing how the treatment is interacting with the normal tissues inside of an individual, and we can take steps to ensure that any normal tissue that's close to or in a treatment area is being protected to the greatest extent possible. Radiation oncology is a field that is not well understood even among physicians. And so there's a lot of information that's out there on the internet, for example, that is not accurate and it can make people very anxious. We urge everyone to talk to us. We are happy to spend time going over any concerns that a person may have about the treatment. We feel that knowledge is power, and we want you to have the knowledge that's associated with your condition and with the treatment, because that makes overall for a better quality of life for you.